Executive Plastic Surgery, Bloomfield Hills, Michigan. So this is a very interesting case. Nice patient from Idaho. Comes in with a set of implants that she got in 2014, silicone above the muscle. 39-year-old patient, complete end block. And as you can see, she came to me on an exam. She had what was this outpouching at the bottom and outpouching on the bottom here and also on the top on exam. And you can see it literally end block, the gold standard, complete entire implant capsule removal. No, the implant is 12 years old, 12-year-old silicone implant. So we'll see. We're going to find out if it's ruptured or not. And let's go and see. Now, the other important thing here is if I touch this tissue, you can see it's inflamed, angry. It looks unhealthy, and that's why I removed it. And this was sitting on top of the serratus anterior. So the entirety of this implant capsule has been removed definitively, completely, sincerely. So as I go in, let's see. This was the capsular contracture she had. If I flip this around, you will see again this outpouching right here. So let me go in from here. Look at this tissue, as you can see right here. I just want to highlight this is the capsule, but this tissue certainly is very much inflamed and angry and bad. And so that's why I removed it as well. So let me go ahead and going to enter from here. It is hard capsular tissue. Looks like an intact implant. Look at the way how it's bunched up. You can see this indentation. Again, if you will see how it's literally suffocating itself and compressed together into more like an oval shaped intact implant. If I let go, you can see how this was sitting together like this, and this is the part that was sticking out. So people go, oh, there's a mass sticking out. No, it's not the mass, it's the implant. And so small amount of fluid here, all of this preserved. This is your Allergan 371, just like the nice patient very well said, intact implant. And you'll see the capsular tissue so small, you can see my green glove right behind it. And block, the gold standard, you can see it doesn't take much to cut through it. If this was ruptured, we don't want this to spill into the chest, hence the purpose behind what is this complete end block. If there was any fluid, we would have it all contained. So I'm going to go ahead and rest this here. I'm going to remove my top sterile glove. I'm going to have another glove underneath. And left side, you can see I removed a lot of this excess skin. It was above the muscle. Now remember, if you go to 1,000 plastic surgeons, board certified, the real deal, good, professional, experienced, seasoned plastic surgeons with 30-year experience, almost all of them will say the better location of the implant is below the muscle, hands down, no questions asked, less problems, less contracture, less issues, less everything. And this is conclusively proven over the years. Now we see a set of doctors trying to put implants that preserve above the muscle, and number one, not be putting in a micro-textured implant. Number two, they should not be putting above the muscle. Number three, not be putting an implant at all. And this is something that time will only prove that is going to be dead wrong once again. Above the muscle, micro-textured, same problem as textured to an extent, and you will see the same set of problems are going to repeat themselves, and we're reinventing the wheel. So going back to here, the left side, you will see the scar down here, complete full thickness for the contouring. Again, look at this pointiness. You can imagine how much the patient was stating that this was present a few months after, and this is the capsular contracture. You can see the band right in the middle. This is how it was compressed. Literally looks like a brain. Complete End block, the gold standard. And so let's cut this open and see what's the status of the implant. We do not want to find out during the case. This is the time to find out if it's ruptured or not. Remember, we don't believe in the MRI because the MRI is not 100% accurate. We saw this last week. And so I'm going to go ahead and cut this open. Again, remember that capsule is bad, but this tissue is also bad. In my practice, I remove it because this is part of the inflammation. So what I'm going to do is I'm going to actually go ahead and just kind of pinch this together because it's very tight. I do not want to hurt the implant. So we're going to go in. Looks like an intact implant, and you can see, look how thin the capsular tissue is. You can see my scissor. And what I want to do is I want to cut it open so you can see how this implant was like compressed together. And you can see that how this forms. And we're going to keep it like this. And no matter how thin it is, you can see the entire capsule is removed. I heard from another patient that her surgeon said it's cannot be done. No, absolutely can be done. Where there's a will, there is a way. And so look at this. I'm just going to keep holding it like this. And look at the way this implant was sitting like this. And so now you're feeling this bumpiness. So intact implant, this is your 371 Allergan intact. And here's that very thin, you can see it, my green glove in the back. Complete total capsulectomy and block, the gold standard. Now, what I'm going to do is with the swab, just because I have these extra from the pack, I take a culture from the inside and I send it to the microbiology lab for aerobic, anaerobic, and fungal. So this is a good sample that I'm going to take shortly. Implants will be returned to the patient, capsules to be sent to pathology, cultures for aerobic, anaerobic, and fungal, twilight deep sedation, no need for drains. Blood loss literally was 3 cc's on the right, 3 cc's on the left. We'll see how she does without the drains. There was a lot of inflammation present, as you can see. And the implants literally were gravitating down just because of the sheer weight of the implant. And remember, skin stretches. Implants were much further up when she had first gotten them in 2014. And over time, they were just going downward and outward. And there was a lot of asymmetry present. So she's only looking aesthetically better already. And we'll see how she's going to pan out over the next several months, up to a year, year and a half. This is where the gravitational pull of the implant is going to be no more, and so the breast tissue is going to recoil for someone who's only 43. The breast tissue is going to fluff out now that there is no implant in the proximity of the breast tissue. Number 3, she's going to work out and going to build up on the muscle mass. That's going to add 10-15% muscle mass to the chest breast area. Once the inflammation subsides, you're going to see the skin is going to recoil by 30% or so, and that in itself will help aesthetically realign the skin and the breast tissue. And also the breast tissue was not touched at all, and the distance from the nipple down to the crease was maintained on both. So there you have it. This is Dr. Khan, Executive Plastic Surgery.